Hello, Professor. This is Harleen Kaur. My student ID is 132270232, and my assignment name is monoamines oxidase inhibitors, that is MOIs, and my other group member is Navpreet Kaur. So I'm beginning with the slides. So first is the introduction. Introduction constitutes that MOIs are the antidepressant drugs. They work by inhibiting the enzyme monoamines oxidase A and B, and it increases norepinephrine, dopamine, serotonin in the brain. And though it's not the first drug of choice, next is the history of MOIs. If we talk about MOIs history, so it's found in between the era of 1950s, and it came under one of the first effective antidepressants. It's one of those that are one of the most effective antidepressants and are being used, but they are not the first choice of drugs used, because later we came to know certain pharmacological effects that they have, with certain considerations that we need to follow. Next is the types of MAOIs. So we have two, that is specific monoamines inhibitors A, specific monoamines inhibitors B. So first, if we talk about monoamines inhibitors A, it's associated with side effects, that is the cheese effect, tyramine rich food. So it means that people who are patients who are taking specific monoamines inhibitors A, they are restricted to take any tyramine rich foods, because they can cause the effect which we generally call as the cheese effect, which induces the hypertensive crisis. Patients are prone to get serotonin syndromes when they are taking these medications with SSRIs and lithium. And this is not for the children. Children are not allowed to take these kind of medications. We are not allowed to administer these medications for children because they are not made for them, and these includes meclobemide, sulfonamide, and lezabemide. Next is specific monoamines inhibitors B, which is used in the treatment of Parkinson's disease, and it includes salicyline, resergyline, and it's one of the orally degraded salicyline formed recently. So it means that recently salicyline drug is being formed that is being orally degraded, which has a effect that it prevents the toxic metabolites, and which is a positive effect of it. And the most important thing is that it do not induce hypertensive crisis. So specific monoamines inhibitors B do not induce or causes hypertensive crisis. So patients while taking these kind of medications can have any tyramine rich foods, which is not the same with the previous one. Next is the uses. So it's used in depression, it's used in the panic disorders, it's used in when people have when patients are coming with social phobia, a sort of conditions, and it's used in conditions having resistance towards other drugs. As I already cleared that this drug is not the first choice of drugs because of its certain adverse and side effects that includes hypertensive crisis and serotonin syndromes. So these are the drugs that are our last preferences when all other drugs are not being considered, either because of resistivity or with respect to certain administrative considerations towards the patient. Thank you.
Good morning, Professor. My name is Navpreet, student ID 132255233, and now I'm going to present my parts. First, I will start from the mechanism of action. As we know, the MAOI inhibitors act as the antidepressants. So, how they will act? The MAOI inhibit the monoamine oxidase enzymes. Basically, our body has the two, that is MAOA and MAOB, which will break down the neurotransmitters, like lower down the level of the serotonin, norepinephrine, and dopamine in the brain. Next part is the adverse effects. We divided it into the two, that is the common and the serious. For the common, that it includes the orthostatic hypertension, that is the drop in the blood pressure when the patient is standing. Next is the weight gain, that is due to the loss of the increase in the appetite and the metabolic changes. Next is a sexual dysfunction, that includes a decreased libido, insomnia, difficulty in the sleeping pattern. Next is the dry mouth, that is due to the decreased saliva production. Next is the serious hypertension. It is basically the two, that is the hypertensive crisis, a severe increase in the blood pressure that is triggered by the protein or the other rich diet, which we will discuss in the further part. And the second is a serotonin syndrome, potentially life-threatening condition when combined with the serotonin drugs leads to the confusion, agitation, increase in the heart rate and increase in the blood pressure. Next are the contraindications. It is again divided into the two, that is the absolute and the relative. The absolute, that is the pheochromocytoma, that is the tumor that can cause dangerously high blood pressure. Next is the hypersensitivity to these drugs, allergic reaction to such medication. The next is the relative. The relative includes the cardiovascular diseases, that is due to the increased cardiac output or increase or decrease in the heart rate. Next is the cerebrovascular diseases, that is increased risk of the stroke. Next, the liver diseases, that is there are the chances of the impaired drug metabolism, severe renal impairments due to the drug inclearance, and the last is the history of the frequent headache. If the person is having the headache so much for the last 2 weeks, there is a risk of exhibiting these conditions. Now the question arises, being a nurse, what is your nursing responsibility? It includes monitoring. What we will monitor? We will monitor the blood pressure, regularly monitor the blood pressure after every 2 hours, then monitor the signs of the serotonin syndrome, that is a very common side effect. It will, especially if the patient is on the other medication. Next is the dietary intake. Encourage the patient to avoid the tyramine rich food. Next is the liver function test. Regularly monitor the liver function test because there is a high chances of the hepatotoxicity. Next is the education. What we will educate the patient? First, it includes the dietary restrictions. Teach the patient to avoid the foods like cheese, cured meats, and fermented products. These are the same as in case of the gout. The last is the medical interactions. Warn the patient about the risk of taking the other drugs with these medication, and if any other symptoms arises, report it to the doctor. Okay, now we came to the last part, that is the conclusion. What we discussed in the whole presentation. First is the MAOI effectiveness. These are the potent antidepressant drugs that enhance the mood by increasing the neurotransmitter levels. Then we talked about the adverse effects, type of the medication, and then the dietary restrictions, which is the very important, critical to avoid the tyramine-rich foods and serotonin drug interactions. And the last is the monitoring and the education, essential for the self-management of the patient, requiring the regular monitoring of the BP, that it may leads to the high orthostatic hypertension. So a nurse must monitor the BP after every 2 hours. Then is a liver function test to avoid the hepatotoxicity, and patient education on the dietary intakes. Thank you, Professor, and have a good day.